my line of work, we do a test called a bone densitometry test. And if I take the time, and this has happened to me, where I look at the study, actually open the study up and look at it and try to determine whether or not a good job was done. And I take a look at the numbers and say, you know, oh my gosh, the gentleman who had this bone densitometry study done, the snap from his Levi's jeans, which were flapped open, is the snap is degrading the image quality and causing the bone density of his left femoral neck to be increased, so much so that the density is way out. Let's call the patient back and repeat this part. And I put flags all over the study. Do not read the study. We're calling the patient back. Don't read it, don't read it, don't read it, all over the exam. We call the patient back, and while we're getting the images, some other radiologist at some other site, because now it's being read at several different sites by several different radiologists, reads the study, reports it, and it gets read. My technologist tells me, Dr. Lundell, some other radiologist read it. And I said, well, you call the radiologist and you tell him to make an addendum to the report now. So that radiologist then calls my boss and says I'm interfering. And then I get a note, what are you doing, Dr. Lundell? You're interfering with us getting the numbers out. We need to get the numbers out. And I said, well, you know, it's the right thing to do. We need to get the numbers correct. Well, it's not going to make a difference. He's still going to get the same result. The result is going to be normal. Well, when he comes back next year, it's going to show that his bone density has significantly decreased, and he's going to have to go on medication. Whereas if we do the right thing, his bone density is going to be the same from year to year, and he won't get medication. It's the right thing to do. Well, do you see how if you just take a little bit of time, but do I get reimbursed for it? No. I actually get dinged for it. That has to change.